Hello and welcome to this special show on Rajya television. I am Vishal Dahiya, and here we take a stock of India's battle against COVID-19. Now, Prime Minister Narendra Modi has launched a people's campaign today asking everyone to stand united against COVID-19. In view of the forthcoming festive season as well as the winter season, in addition to the gradual opening up of various sectors of the economy, the focus of this particular campaign is on reiterating the message in general public about ensuring hand hygiene, wearing a face mask and practicing social distancing as well. We'll try and understand the high points of this particular campaign as well as the way it might have the desired effect as far as this battle against COVID-19 is concerned. And for more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with, we have Urvashi Prasad with us, a public policy specialist at Niti Aayog, dealing with the health sector. We also have with us Dr.Rajib, Dasgupta, Chairperson of the Center of Social Medicine and Community Health at Jawaharlal Nehru University, and Dr.Archisman, Mohapatra as well, Epidemiologist, joining us on this particular show. Welcome all of you to Rajya TV. Let me begin with you, Urvashi, and let's start by understanding the rationale behind having this sort of, high-pitched awareness campaign.
Yes, so I think as you put it, at the outset, we are, entering a period which could be quite tricky in terms of the festival season where, traditionally people do meet in large gatherings, people do go out into markets, other public places. So that happens traditionally as well. And then the winter months where we don't quite know how this is going to behave yet, because, of course, this is something very new. And while we have experiences from other part of the world, we don't know in India how it will play out. So that is the reason for the timing of this campaign at this point. And there are really two very sort of broad elements to this. One is that, of course, making people aware in each and every corner of the country, because while in a large metro you might see people are by and large aware of at least the basics of wearing face covers and distancing and hand hygiene, you might have some parts of the country where exactly how to go about this might not be so clear. It's one thing to give out a high level message, but to ensure that it trickles down to each and every person in the country. So I think that is one sort of high-level objective of this. The other is that people who are aware of the preventive measures to follow, but might be getting a little lax about it or might be getting a little laid back about it, how to sort of re-emphasize to them that this still very much remains a priority. Yes, at the national level, the fatality rates, if we look at the statistics, they have been going down. But in many parts of the country, we are still seeing a fairly large number of deaths. Often these are happening in younger people because India, of course, is a much younger demographic compared to, say, Europe or even the US. So it's also to sort of re-emphasize that we cannot let go of, our precautions at this stage, even if we feel the disease is milder or, not as severe. So I think those are the two high level. In just briefly in terms of the strategies, there's going to be obviously mass media strategies. A lot of them will use, messaging from the highest level, so the Prime Minister himself, and we've seen that often that sort of high-level messaging also helps. But then there will be much more tailored strategies as well, which will use local communication channels, different strategies being carved out at the district level, and using a range of different types of communication, so not just the mass media, but also the local community radios, for instance, and very much doing it in collaboration with civil society, with volunteers and others.
Okay. Dr. Rajib Dasgupta, I'd like to bring you in here in terms of, your views on the strategy adopted for this particular campaign. And also, perhaps, as, Urvashi was pointing out, we can also term it as sort of a pandemic fatigue in general population to a certain extent, wherein people become, lax in their approach towards ensuring all these measures, which are safety measures to be put in place, specifically wearing a mask or ensuring hand hygiene, all these places. Everybody knows about it, but somewhere a lax approach tends to, creep in.
Well, there's been a media report of a survey in the last 48 hours, which reports that while about 90% are aware of it, roughly 40% actually practice it. And this is 6 months down the line of having done a whole lot of measures. And as Urvashi said, it's about reinforcing, it's about re-emphasizing, and so on. But if this is the gap of 90% actually being aware and 40% practicing, it certainly means that it's not about re-emphasizing, but about rethinking as well as introspecting what's been right and what's remains to be considered essential, which has been missing, so that we have this rather dangerous level of practice. Of course, the Prime Minister himself has been leading it from the front. He will continue to do so. But one fundamental pillar of the pandemic response that the WHO laid out right at the very beginning, and there's nothing new for this, it's a very standard thing, is risk communication and community engagement. I believe it's, and I've said this several times, that it's really community engagement which is where we have been absolutely missing the bus. Otherwise, the usage after 6 months, after 60 lakh plus cases, 1 lakh plus deaths, the usage can't be so low.
Okay.
So somewhere we really need to introspect, and we really need to re-engineer things. If you ask me, it's a new emergency that we need to recognize.
Okay. Dr. Mohapatra, would you agree there that time for re-introspection and rethinking out there, perhaps the strategies as well?
One very nice approach that has been adopted here is a very concerted strategy, targeted and contextualized strategy to reach out to the last woman standing in the queue. So this really helps in engaging with the community and also making it more mobilized for the cause of fighting out this pandemic. Now, it also counters the surge in misinformation or any disinformation that has been communicated inadvertently or deliberately by different sources. This said, what needs to be done is a process in which there is constant retiteration of the efforts according to the community's response to it. Now, we have seen that there have been efforts to engage with the community, to mobilize the community, but still social distancing practices were actually violated. People came out in hordes. So those kind of adverse reactions must be countered, must be actually preempted and taken into the overall strategy. So the really best part is that there is a lot of engagement with the influencers, with the district level volunteers, adaptation into local language, contextualizing the messaging system. So that I really appreciate that strategy going out there. I also saw that that a game was launched, a new a guide book has been launched. So many resources have come out, and more people should access that. Making it commonplace also helps in fighting out stigma, so people would be more open about care seeking. So those aspects are also taken care in this strategy. So appreciate the effort.
Okay. But one more aspect here, Dr. Mohapatra, and when Dr. Rajib Dasgupta mentioned introspection, that pretty much applies to the other part of this two-way communication, that is the community or the individuals out there, population. Obviously, strategies will have to be reworked every time because this is an evolving situation. But that introspection and those numbers which Dr. Rajib Dasgupta referred to clearly shows that the general population, the common man, you and me, we can't, take it for granted.
Right. So as he rightly pointed out, the no-do gap. So people are aware, they're not practicing. That usually happens with our community, and that requires more sustained efforts. Now, when you're talking about appropriate behavior, who actually is a target audience? Is it just entirely the community? Or there are other stakeholder constituencies that must also engage in this entire behavior change movement? So it has to be a very structured approach with engagement of all stakeholders. Media has a very strong role here to play. Social media, responsible behavior on social media has to be there. There has to be personal accountability. The government and the local representatives, they have a role to play. So they are not on the same gradient actually. So they are all on different gradients, and you need to think of this kind of a system-wide, society-wide engagement in your communication plan. If it is very consistent through and through, then of course the no-do gap is likely to narrow down. Of course, there shall always be a no-do gap, but still some narrowing down, some consistent behavior would come in.
Okay. Okay, Urvashi, how is the this particular campaign which has been launched now takes care of that community engagement part because that's really important, as both Dr. Mohapatra and Dr. Rajib Dasgupta are pointing out.
Yeah, so I think there's two aspects that I'd like to touch upon. One is that of course I think there's a clear recognition that whatever strategy we have will have to be contextualized to the specific context. I mean, anything in India, one size fits all, we know it does not work. So while the Prime Minister might give out some high level messages and that would obviously have some impact, that needs to be backed up with a lot of specific action at the local level. And so I think that is inbuilt into what is happening here. And what we're also trying to do is look at some of the practices that already states and districts have implemented that have worked well for them. And also try to create awareness about those, because if I look at specific districts, we have Mewat in Haryana, which found that the community radio was very effective in getting the messages out and sort of combating fake news, etc. We had the Break the Chain campaign in Kerala, which they used very effectively for hand washing promotion. We've had a campaign for driver and road safety in Jharkhand. So we're actually putting together all these good practices as well, and we would like to disseminate these also across states and districts, because a lot of the times the solutions are there, but they need to be adapted and contextualized to a particular district or to a particular state. So I think that is one part of it. The other is on engaging people, and obviously I think it's clear that the government by itself cannot do this. So I think there is definitely a strong outreach effort with, of course, civil society organizations, with community-based organizations. Again, a lot of districts, states have used the self-help groups very well to actually create a community sort of system of monitoring. While you don't want to create vigilantism, but you do want the community to also sort of monitor itself, because the government cannot be there all the time everywhere. And also the employers. So very recently, the government actually came out with a set of guidelines for workplaces and different kinds of workplaces. So I think the employers also have an accountability in this, that, when you have people at your work sites, what is going on there? Are the protocols being adhered to? So I think definitely we need a lot of different stakeholders coming into this. There is an effort to reach out to them. From the government. A lot of it, of course, will not just be central government. As I said, it will go down, right to the state and district and city level. But there's also sort of accountability of individual stakeholders, especially, like I said, employers or even citizens, especially citizens who are informed, who are aware. I think there's also an accountability responsibility we have. Because in any public health crisis, it's not our behavior just affecting us, but it's affecting everyone around us. So I think it's also contingent on us to also get that message out as strongly as possible.
Okay. Dr. Rajib Dasgupta, would you agree out there, as Urvashi is saying, that, obviously there are success stories and there are models which can be contextualized further and amplified in different situations, in different, surroundings as well. But when we talk about community engagement, the point which you brought in, it's basically a two-way communication, and all other stakeholders. Now that reopening of, various sectors is happening, then the number of stakeholders here also gets multiplied. So all of them will have to work together.
Yes, of course. All that Urvashi has said is absolutely right. Of course, there are good examples. The point is that are we really going to transplant some of these models, or are we actually making an effort of building things bottoms up? Therefore, as also very rightly said by you, very rightly said by Urvashi, a lot is going to depend on how much we are going to invest, how much we are going to empower the local, how much money and resources we are actually putting into social science research. The fact is that stigma certainly remains deeply rooted and expectedly so for a disease which is so infectious. for a disease which certainly has mortality, particularly in higher age groups. So these are very real situations, and it's not easy. Building up a community engagement process is the most difficult, is the most, if I may, unrewarding compared to many other interventions that we do. And it's certainly the one which requires sustaining and nurturing the most. Do we actually have those skills? Do we actually have those human resources? And how much have we invested in the last so many months to actually build these? This is let's face it, that this is a challenge of completely unforeseen magnitude, of unforeseen complexity. We are, for example, monitoring a whole lot of data. It's testing data, this rate, that rate, and so on, which has all become common parlance, which we thought was only our trade and our jargon. But to that extent, are we measuring behaviors? Are we actually measuring practices? The answer is no. So measurement is important, empowering is important, investing in skill building is important. It is actually, as she said, as Archisman said, it's a tremendous effort and a tremendous scale of things that need both imagination as well as investment.
Okay. Okay. Dr. Mohapatra, does that mean that behavioral change becomes the key word here? You know, when we talk about either community engagement or those awareness programs, ultimately it then comes down to, once again, the individuals as well as other stakeholders who are there on the ground.
Yeah, behavior change is key. Some of the behavior is already in our practice, but adapting to the change situation is important. One thing that is challenging is the public is now much more exposed to scientific evidence. Now, we as researchers, we as faculty members, we know that evidence keeps correcting its position. So we have that agility of correcting our understanding of the evidence the way it has been generated. So things that were in March, things that are in September, October are different. We have this ability of adapting to it, but the community doesn't have this much clarity. It's very new. It's very new to the general public. It's very new to the media. It's very new to the other stakeholders also. So how do they constantly correct themselves, and how do we manage a structured communication or a behavior management strategy that is appropriate not just culturally but also scientifically? So that's a bit of challenge over there. But of course, behavior change management is the key to fight out this pandemic, given its scale and the type of burden it actually holds in terms of mortality, morbidity, or fear, or stigma. So many aspects to be addressed.
Okay. Okay. Urvashi, your views on that, the behavioral change part, because that ultimately, decides or rather ensures as to how things move on the ground there. As you were saying earlier, in a public health emergency, what you and me do has implications on several others, not only on us.
Yes, and behavior change, of course, I think as we understand it, it's not easy. It's a very complex space, and it's not easy to change behaviors often, especially in a short span of time. And here we don't have time on our side, unfortunately. And a lot of the issues we are facing here have actually been long-standing issues in our health system. So stigma, if we see, stigma is not just with COVID, it's there for tuberculosis, it's there with mental health, it's there with cancer. Of course, right now it's sort of very, amplified because we're in the middle of a pandemic. So yes, I think there are certain longer-term, more systemic issues, which of course will need to be addressed. But I think in the immediate term, we do need to, focus on building on whatever we have found to be successful, even if in a smaller context so far, and sort of build on that. Very much focus on engaging different stakeholders, because certainly the government by itself trying to do this is not going to achieve the desired results. So there has to be a huge focus on collaboration, be it with civil society, be it with community-based organizations, grassroots NGOs, employers, as I said, workplaces of different kinds that have now started to open up. So I think that would really be our best bet right now to see how we can quickly use whatever platform that we have had and built up over the last few months. Yes, of course, there are flaws. Yes, of course, it's not perfect and we have so much more to do. But given that we have very little time and we need to sort of respond very quickly, we should try and build that up. And I think that is also at least the intent of the government to do that and to come up with very specific strategies for different parts of the country, different districts, as I said, so that we can actually have something more effective in the different contexts.
Okay. One more aspect here, Urvashi, before I go to Dr. Rajib Dasgupta for the final comments, and that's a really important aspect of the overall strategy, which was mentioned by Dr. Mohapatra as well about, infodemic. There's an information surge as well. Obviously, we're trying to go ahead and make people aware, make them understand, bring that behavioral change as well. But equally important is fighting the menace of that fake news or fake information, which overflows over a period of time, and that confuses an individual in finally arriving on the right kind of information.
Yes, absolutely. I think that is something we have had to sort of deal with from the start. Of course, partly it is because it's a very new disease for everybody. And of course, information is changing very quickly, very rapidly. What is recommended, what is not recommended has also changed over the months. So part of it is that, and part of it is, of course, deliberate sort of misinformation being put out. And again, a lot of states have developed means of tackling this, whether it is having a single portal of information and, asking citizens, encouraging citizens to sort of, only take verified information from there, or putting out through, local channels, again, through local leaders, community leaders, religious leaders, making sure the right information is getting out to people who are influencers, essentially, in the community and whose voices matter. So I think that effort needs to continue. We need to build on wherever we feel we've seen successes with the different models. As I said, people have used technology also in a big way. Interestingly, technology has been used to also spread fake news in many cases, but also to combat it in several cases, to, also as a countermeasure by many state governments. So I think we do need to continue to focus on that and to make sure that, we get the verified sources of information to people, because often it is difficult to know, where do I really get this information from and where is it going to be reliable. So I think, we'll need to continue. All of these are definitely challenges, and a lot of these are longer term systemic challenges, coming from a public health space. I have seen a lot of these over the years, and they just get sort of amplified in the midst of a pandemic. So yes, we might not be able to tackle everything, right now. But we must use, whatever channels we have. We must use a localized strategy, and we must reach out to as many stakeholders outside the government as possible, because I think that's really the best way to mount a response in a short period of time.
Okay, definitely multi-pronged strategy out there, as Urvashi is pointing out. Dr. Rajib Dasgupta, before we bring this discussion to an end, from a public health expert's perspective, what would you want to say to the individuals, to the general people out there in terms of what needs to be done in these pandemic times, specific 3-4 aspects, as the awareness campaign is also talking about? The face mask, hand hygiene, respiratory hygiene, as well as, social distancing.
Well, what we need to primarily recognize is that it's a much longer game that we may have initially. At the outset, perhaps all of us thought that it would be a few months of a lockdown and it would be then business as usual. We know that the economy is talking of recovering now over several years and not months anymore. And that's equally true of the pandemic situation. That's equally true of behaviors of preventive practices and so on. And therefore, this is actually what everyone has been saying all along, that it's a lot got to do with how individuals will themselves behave, practice, and most importantly, understand and perceive their notions of risk. And this whole understanding of risk is something, how each individual is actually perceiving his or her risk, whether in the home, in the workplace, or in other public spaces, is something which really invested a lot into. Perceptions of risk need to be understood, and that's really the basis of framing communication strategies and then being able to sustain it. Of course, investment is crucial. But then what's going to matter at the end of the day is that it's got to be done with a human face and with a human touch. And mass media or even social media can only do so much. And both these aspects are complementary.
Okay. Thank you so much, Dr. Rajib, Dasgupta, Urvashi, as well as Dr. Archisman, Mohapatra, for sharing your views and time with us and our viewers on this very important aspect, that is the awareness campaign which has been launched by the Prime Minister. The focus here clearly is ensuring community engagement as well as behavioral change when we talk about the need to deal with COVID-19 pandemic in a united manner. As our panelists are pointing out, we are in it for a little longer haul than all of us expected earlier. And the key to this winning this battle is to ensure that we do not lower our guard and practice three basics. Wear a face mask whenever you're stepping out of your house. Ensure proper hand hygiene and respiratory hygiene, and also practice social distancing. We'll come back again tomorrow with a different topic. Till then, keep watching Rajya Sabha Television. Thank you.